Good Thursday afternoon. I'm Dr. Martha Buchanan, Director and Health Officer here at the Knox County Health Department. Our moment of gratitude today is dedicated to all the folks that work hard to ensure the Board of Health meetings come together each week smoothly. From the IT component of putting together virtual meetings, to our partners at community television for streaming the meeting live to the public, to our KCHD and county support staff for handling all the details that are required with orchestrating weekly meetings. We are incredibly grateful for the work that you do for this community. Our real-life example of putting the 5 core actions into play is going to the gym. First and foremost, if you're not feeling well or you've been exposed to someone who has COVID-19, you need to stay home. Before you go, call your gym and see what precautions they have, what they are taking that you should be aware of. For example, some gyms, the locker room access may be limited to the restroom area only. They may also screen you for illness or even take your temperature prior to entering the facility. Once you arrive, we recommend you wear your mask anytime at least 6 feet of distance can't be maintained, such as in the weight rooms, group fitness studios, or check-in areas. If you find wearing a mask is too difficult while working out, consider doing any vigorous exercise outside, since distancing can be easier to maintain outside. Wipe down machines and equipment with disinfecting wipes before and after you use them. And make sure you wash your hands before and after working out. If you don't feel comfortable going to the gym, that's fine too. Many gyms offer virtual classes and training sessions. Call ahead to your gym to see what options they are providing. Those are just a few steps that you can take to keep you and the folks around you safe and healthy while still going about your life. Now I'll move to the local situation. We have 121 new confirmed cases since yesterday's report, giving us 7,877 confirmed cases of COVID-19 in Knox County since March. Additionally, we have 283 probable cases. 6,294 of our cases are considered inactive, giving us 1,847 active cases. 297 individuals have been hospitalized at some point in their illness. 38 Knox County residents are currently hospitalized. Fortunately, we have no additional deaths to report today, keeping our total at 64. Now we're transitioning to the benchmarks. As a reminder, for the majority of our benchmarks, what we want to see is no 3-day statistically significant shifts within a 2-week time period. Every day we look back at the previous 2 weeks. That's what a rolling average is. Overall, what we mean by this is we are trying to see, are things getting better, staying the same, or getting worse, and then how much better or worse, and at what rate. As a reminder, all of this data that we are going to talk about on this is on our website. You can find it at covid.knoxcountytn.gov/case-count. Moving to the first benchmark, sustained reduction or stability in new cases for 14 days. To illustrate this benchmark, we have a bar graph that shows previous cases, new cases, and the growth rate over time. At the time of the report, we had seen 5 consecutive spikes within the last 6 days, indicating a statistically significant increase in cases. Because of this, we are representing this benchmark as red. As we mentioned last week, cases appear to be trending upward, and that is exactly what happened. The majority of new cases we are seeing are in the 11 to 20 and 21 to 30 age groups. As school is now well underway, this further stresses the importance of following the 5 core actions in every situation. Students and parents need to make sure they are following these actions, not only inside the classroom, but outside the classroom as well. That means social gatherings, study groups, going out to eat, or any other social activity you might engage in. Our second benchmark, community-wide sustained and increased diagnostic testing with consistent or decreased test result reporting turnaround time. For this benchmark, we are utilizing two bar graphs. One that shows a sample of the tests conducted for Knox County residents, and another for the average time between specimen collection and lab report data. Over the 14-day evaluation period, lab turnaround time continues to trend to less than a 2-day average, which is a positive indication. Regarding testing, we saw some red flags for the number of tests conducted, but they were not on 3 consecutive days. Last week, we had this benchmark as a cautious green due to the flags we saw relating to the volume of testing. This week, the volume of tests conducted isn't rebounding like we'd hoped, leading us to represent this benchmark as yellow. Our third benchmark, sustained or increased public health capability. For this benchmark, we aim to initiate new cases in 24 hours and close contacts within 48 hours. We continue to be able to initiate investigations in this time frame. Because of this, our benchmark continues to be represented as green. With the existing EPI support team in place, we're able to handle the current caseload. However, we are looking to expand this team based on the larger volumes of new cases that we've recently seen. We will, of course, continue to evaluate this and make any appropriate changes as the situation evolves. We are continuing to work with UT and Knox County schools and their respective contact tracing teams. Our fourth benchmark, healthcare system capabilities remain within current and forecasted surge capacity. These graphs show the availability of regional hospital beds, ICU beds, and ventilators from our hospital partners. It also shows the additional surge capacity for these categories, as well as the COVID positive patients and the patients with pending test results in the hospital. These data are gathered from the information hospitals put into the Tennessee Healthcare Resource Tracking System, or HERTS. It may reflect Knox County, East Region, or patients from other jurisdictions. We saw no flags regarding hospitalizations or ICU beds. However, we did see 4 consecutive days of yellow flags for ventilated patients. After speaking with our hospital partners, they stated their benchmark should be represented as yellow. The hospital systems continue to meet daily, assess the situation, and plan their response together. As always, decisions regarding how to classify this benchmark as green, yellow, or red are made in concert with our hospital partners, as well as taking all the data into consideration. Our fifth benchmark, sustained or decreased COVID-19 related death rate for identified positive or probable cases. For this benchmark, we use a graph that shows the reported deaths of Knox County residents by date of death. Over the past 2 weeks, we have seen 10 deaths, with 7 of those reported in the last 7 days. Because of that, we are representing this benchmark as yellow. And now I'll open it up for questions.
All right, as a reminder, please go ahead and submit your questions into the chat feature by typing them in. And please type in your name and the media affiliate that you're associated with. The first question we have is from Vincent with the Sentinel. Who told Dr. Buchanan that she was a non-voting member of the Board of Health?
It's a really great question. That has been a standard way of operating for several years here at the health department. The previous director, Mr. Jones, considered himself a non-voting member. I don't know who he heard it from. It was something that had always been practiced. And honestly, in the past, the board voted on our budget, and that was really the only thing they voted on in the past. So that's a change. I'm happy to be able to vote and participate more in the Board of Health's decisions.
Also from Vincent with the Sentinel, Dr. Buchanan mentioned that there was a meeting between herself and the UT Chancellor Plowman earlier this week where Plowman had asked her to take action to prevent COVID spread. What action did the Chancellor ask her to take?
I believe I spoke about that last night in the Board of Health meeting. She asked us about considering doing a geographic closure of bars and restaurants, similar to what something that Nashville had done.
His follow-up question is, who else was present at that meeting?
There were several people present at that meeting. I was just representing Knox County Health Department. Someone else convened that meeting. So for details about that meeting, you might reach out to Chancellor Plowman or perhaps Unified Command.
From Paul with WBIR, we know UT cases are driving a significant increase in cases in Knox County. Are you seeing cases in other groups and demographics of population increase too?
So we are seeing, like I said, we're seeing our largest number of cases, 11 to 20, and kind of 11 to 30-year-olds. So that's kind of our school-age kids and college or university students, and then just the general population. So those two populations, Knox County schools went back to school, UT went back to school. We're not surprised, and other places have gone back to school. So we're not surprised by seeing some increases in those age groups at this time. What we hope is that the schools and the university, and we can all work together to reduce risk within those populations so that we can see those numbers flatten out as well.
From Jeff with WATE, do you have any further detail on what was causing concerns when it came to test volume?
We don't. So what we're concerned about when we see numbers of tests going down, the numbers of tests being done going down, what we know is that there's not a problem with supplies or access to testing that we're aware of. So when we see these numbers going down, knowing that supply chains are adequate, we worry about two things. One, people not getting tested because they're afraid to know they're positive and they don't want to have to be in isolation or have their family in quarantine. And that's understandable. It's frustrating to have to stay home for 14 days and not go to work. So those are real concerns. But also, we also are concerned about people who maybe people are just becoming complacent and kind of like, I don't need to worry about it. COVID's not that big a deal. And that's also a concern. Both of those are a concern because that means we have people walking around who have COVID, who don't know they have it, potentially exposing others.
From Vincent with the Sentinel, what is the Board of Health's job under the TCA in Title 68-2-601?
Well, it's explained in there pretty clearly. If you're referring to the TCA that establishes the Board of Health and says who the members are, I don't have the numbers memorized, but it states very clearly the Board of Health has a responsibility for setting policy and to protect the health of the community. That's a very paraphrased version.
From Jeff with WATE, in general, how severe are the symptoms and cases among younger people?
It varies. Young people can become very ill from COVID-19 and end up at the hospital. So that happens. It's not as common in as it is in older folks. So the severity of illness varies in young people, just like it does in older people. They can be very mildly ill and maybe even asymptomatic to ill enough to have to go to the hospital and everything in between.
From Brian Hornback, are Knox schools accepting suggestions from KCHD, or are they truly working solo? It seems by perception that Chancellor Plowman and UTK are more engaged with KCHD. Is this perception right or wrong?
Oh, it's very wrong. Sorry to be so direct. We are in constant communication with Knox County Schools and UTK. Actually, we have set up, both places have their own internal contact tracers that we're providing support for and leads for those groups. Also, we're using Teams to communicate internally here at Knox County Health Department, but we've also created a Teams group for Knox County Schools and a Teams group for UTK. So they're communicating directly with our staff on a very regular basis, 7 days a week. That communication is ongoing. As mentioned previously, we have a standing meeting with Knox County Schools leadership to discuss any concerns they may have or answer questions once a week.
From Paul with WBIR, can you talk about pre-symptomatic spread? Have contact tracers noticed that as a problem?
So it's kind of hard to track pre-symptomatic spread because we don't. So pre-symptomatic spread is somebody who can spread an illness before they have symptoms themselves. And we see this in the flu. People who have the flu can spread flu before they're sick. And with COVID, people can spread it before they're sick. So we don't always know. So what we look at is date of onset of illness, and we go back 2 days, and that's why, because before they get sick, they can spread the illness. So we know that any contacts who become ill from that period, that's the pre-symptomatic period. Then there are other people they might be in contact with later when they're symptomatic. So we look at it all the time. It's very important. So, but we don't really look at it that way. That's just the period of exposure. And when you say pre-symptomatic spread, it kind of makes me think something different, but that's the period of exposure that we're worried about. 48 hours before you become ill with COVID-19. And that would be what you would call pre-symptomatic spread, because the person didn't know they were sick yet.
From Vincent with the Sentinel, what other groups were represented at the meeting with Plowman?
It was a large group of people, and again, Unified Command coordinated that meeting along with the university. So details about that meeting can be best come from them.
Also from Vincent with the Sentinel, under Title 68-2-601, the Board of Health's rules are to be enforced by the health director/health officer. In the meeting last night, it seemed like the board was either unaware of this authority or unclear on the role of Dr. Buchanan as an enforcer of their orders. Can you explain this discrepancy?
Be a great question to ask the Board of Health, what their understanding was.
From Taylor Eddington, I know the numbers of people in isolation and the number of cases continues to rise rapidly at UT. Do these numbers seem surprising, or is this something that was fairly expected with the amount of students?
I think the number of cases going up as rapidly as they're going up is surprising. I don't know that we anticipated that happening. The number of contacts is not that surprising. It really speaks to what we're seeing throughout the community, that the number of contacts each case has gone up greatly because we're out and about and doing things, and honestly because people are not consistently observing the 5 core actions. So it's really important for people to consistently observe the 5 core actions to reduce the risk that they become a contact to a case. And again, you don't know when somebody's going to become a case because they may be feeling fine, and they are feeling fine before they get sick and can be contagious in that time. So observing the 5 core actions consistently and regularly is a way to reduce the number of contacts each case has.
From Brian Hornback, on the issue of the health director voting in Board of Health meetings, is it problematic when the mayor and director may have different opinions and votes? Each member of the board will vote based on their knowledge and their expertise, and I will do the same. From Vincent with the Sentinel, from the conversation last night at the Board of Health, it seemed like the KCHD and Board of Health were relying not on the health director to file enforcement actions, but for law enforcement officers to take action. But law enforcement officers were having difficulty enforcing the rules. Is the KCHD coordinating with the city or county to enforce their orders?
We haven't specifically been coordinating with the city and the county to enforce their orders. We work with the city and county when they have concerns and complaints. We try to go out and work with those places to help them get into compliance. And so that has been our focus, helping people or enabling people or entities to get into compliance, and working with law enforcement as needed to do that. So we haven't, it's not a regular meeting or anything like that. It's just they reach out when they have questions or concerns.
Also from Vincent of the Sentinel, a follow-up question. Are you aware of repeat offenders against Board of Health orders? And if so, are you coordinating a response to repeat offenders with the city and county?
I am not aware of repeat offenders. So therefore, at this point in time, we're not. My staff, again, continues to work with those entities, trying to give them the opportunity to comply. Also, Vincent with the Sentinel, lawsuits against the county have been repeatedly brought up by both the mayor and the law director's office during Board of Health meetings. Is it the job of the Board of Health to avoid legal liability or to protect the public? Well, again, that's a great question for the Board of Health.
From Isabel with the Sentinel, the Tennessee Department of Health changed its guidelines for determining a close contact last week. Is Knox County now using the 15 minutes or more definition when determining close contacts at school?
We are using it everywhere.
Also, with Isabel with the Sentinel, Dr. Buchanan said there is a Teams channel between KCS and KCHD, another channel with KCS and UT. Which representatives from KCHD and KCS are in the Teams channel, and when was this channel created?
That's a lot of detail. My staff that are doing the work every day, that are providing support to Knox County schools and to the University of Tennessee, are all engaged in those teams and using them as a regular way of communicating. It's really helped speed things up. It's HIPAA compliant, so we can use it for lots of things. So it's been very convenient for all of us to use. So several of our team members are all engaged in helping answer questions from both UTK and Knox County schools and back and forth. So I don't have specifics on that. It probably changes based on, so we have teams that work weekends, we have teams that work during the week, and so they shift around. So it depends on which team is on. I think right now we have 4 or 5 teams within KCHD. So it depends on which one of those teams is working, who is supporting the schools and who is supporting UT.
From Brian Hornback, the Knox County Sheriff was clear in media that he would not enforce the mask mandate, as he made a statement on enforcement of the curfew of 10 p.m. bar closure.
I'm not aware of any statement that he's made.
Any other questions, please go ahead and submit them into that chat feature now. All right, not seeing any other questions come in, so thank you all for your time. Hope you have a good and safe rest of your day, and same for the weekend, and we'll see you again next week. Have a good one.